It also contains fats or lipids, known as low-density lipoproteins, or LDL cholesterol. Atherosclerosis begins when LDL cholesterol accumulates in the arterial wall, forming a plaque. Over time, the plaque becomes larger. Some plaques never obstruct the coronary blood flow. The patient with asymptomatic coronary disease has no chest pain and no myocardial ischemia. A plaque can enlarge to the point that the blood flow is compromised. The patient may have chest pain, but only with exertion. This syndrome is known as stable angina and is not a clinical emergency. Such a patient is still at risk for an acute life-threatening event because a plaque can...
बिस्तारै डिपोजिट हुन्छ नि सर्कुलेसन अलिअलि कम गर्छ टेबल कोही लाइन तपाईँको हिँड्दा हट्दा दौड्दा चाहिँ स्यास्या हुन सक्छ छाती दुख्न सक्छ है हैन त्यो पनि के हो तर पुरै बन्द अब त्यो रोकिँदाखेरि चाहिँ फेरि सर्कुलेसन गएर पुरै भाग मरेको छैन पानी राम्रोसँग आएन भने है ब्लड त्यहाँ राम्रोसँग पुगेन है त्यसलाई चाहिँ हामीले चाहिँ स्टेबल एन्जाइना भन्छ यतिकै छ भने भराइ चल्दाखेरि 5 वटा 6 वटा चल्दाखेरि चाहिँ दुख्ने यस्तो हुन सक्छ है
causing clotting of the artery, known as coronary thrombosis. When a thrombotic occlusion is subtotal, an acute coronary syndrome develops, and there are two types. The first type is known as a non-ST segment elevation myocardial infarction, and the second type is known as unstable angina. With these syndromes, the patient experiences chest pain at rest, and the electrocardiogram shows ST segment depression. In contrast, when the thrombus completely occludes the vessel,
त्यही भएर हार्ट एट्याक भएको मान्छे पनि विभिन्न किसिमको लिएर आउँछन् नि तपाईँलाई अचम्म लाग्छ त्यसले हार्ट एट्याक भयो बाँच्यो त्यो हार्ट एट्याक भयो त्यो त गयो हार्ट एट्याक चाहिँ कुन बेला आउन सक्छ है मायोकार्डियल इन्फ्याक्सन भन्छौँ यहाँमै यति त बाँकी हुँदाखेरि पनि आएको थियो नि अघि हैन अझ धेरै थियो तर पनि उसलाई केही सेट मरेको छन् हैन तर एकदमै धेरै एरिया चाहिँ कभर भएन अलिअलि गयो भने चाहिँ अब यो कम्प्लिट ब्लक हुन लाग्यो भने चाहिँ पेसेन्टलाई चाहिँ एकदमै छिटो हैन अन द स्पोट पनि जान सक्ने है कारण चाहिँ यही हो यो चाहिँ बुझ्नु पर्यो है
the myocardium is injured, and the syndrome of ST segment elevation myocardial infarction develops. In summary, patients with coronary artery disease may be asymptomatic, they can have stable angina, or they can suffer an acute atherothrombotic event. Plaque rupture with coronary thrombosis is the most common cause of acute, life-threatening coronary artery disease. Emergency therapy by thrombolysis, angioplasty, or thrombectomy restores blood flow by targeting the thrombus, either dissolving it, displacing it, or removing it as quickly as possible. Rapid restoration of blood flow relieves symptoms and minimizes
Hypertension is a common condition in which the force of blood on the walls of your arteries is often too high. Arteries are the blood vessels that carry blood away from your heart to supply your tissues with oxygen and nutrients. In your heart, 2 chambers called ventricles contract with each heartbeat to push blood to your lungs and through your arteries to your body. As blood flows through them, 3 main factors affect the pressure on your artery walls. The first is cardiac output, or the amount of blood your ventricles push out of your heart each minute. Your blood pressure output increases. The second factor affecting your blood pressure is blood volume, or the total amount of blood in your body. Blood pressure also goes up as blood volume increases. The third factor that affects affects your blood pressure is resistance, which is anything working against the blood flow through your arteries. Several factors contribute to resistance. One resistance, the flexibility of your artery wall. Healthy arteries expand with each heartbeat to help reduce blood pressure on the wall. Another resistance factor is the diameter of your arteries. Your body is able to increase the diameter of your arteries to lower your blood pressure, or reduce the diameter to raise your blood pressure. A third resistance factor is blood viscosity, or thickness. In your blood, more particles, such as proteins and fat, increase viscosity. If your blood is thicker, your blood pressure goes up as your heart works harder to push it through your arteries. Your blood pressure can be measured with a device called a sphygmomanometer, or blood pressure cuff. When your heart beats, the pressure of blood on the walls of your arteries is called systolic pressure. When your heart relaxes between beats, pressure on the artery wall is called diastolic pressure. While your blood pressure may change throughout the day, it should normally be less than 120 millimeters of mercury for systolic pressure and less than 80 millimeters of mercury for diastolic pressure. If your systolic pressure frequently stays above 140, or your diastolic pressure frequently stays above 90, you have high blood pressure. Over time, high blood pressure will damage the walls of your arteries. Your artery wall and form an enlargement called an aneurysm, or the wall may burst and bleed into the surrounding tissue. Small tears in your artery wall may attract certain substances in your blood, such as cholesterol, fat, and calcium, to form a buildup called a plaque. Blood flow through your artery decreases as the plaque enlarges. Blood cells can stick to the plaque and form solid clumps called clots, further reducing or completely blocking your blood flow. Damage to your arteries raises your blood pressure even more by making your heart beat more forcefully. Artery damage and reduced blood flow lead to conditions such as a stroke, heart attack, or kidney disease. In most cases, the cause of high blood pressure or hypertension is unknown. This type of high blood pressure is called primary or essential hypertension. Treatment for essential hypertension includes lifestyle changes, such as eating a healthy diet. If you are sensitive to the sodium in salt, your doctor may recommend limiting your intake of salt and highly processed foods. Sodium may cause your body to retain water, which increases both your blood volume and your blood pressure. Other lifestyle changes that can reduce blood pressure include avoiding excessive alcohol intake, getting regular exercise, losing weight if you are overweight, and quitting smoking. Your doctor may also recommend medications that act on your kidneys, blood vessels, or heart to help reduce your blood pressure. Diuretics, commonly called water pills, cause your kidneys to move more salt and water from your blood into your urine, which reduces your blood volume and pressure. Beta blockers reduce the workload on your heart by decreasing both the rate of your heartbeat and the strength of your heart's contractions. Several types of drugs act indirectly to reduce your blood pressure by relaxing your blood vessels, which increases their diameter. These drugs include ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, and direct-acting vasodilators.